Welcome back. Hope you guys had a nice spring break. If you have my daughters in the background, I apologize because they're kind of fit to be tied at the moment, which I'm sure you guys are too. So today we're going to finish off the notes for this chapter. Don't worry, the test isn't the next time. We're going to do our normal stuff here. We got a little cancer thing I want you to watch in the next video, next day, which will be this Wednesday. And then we got some smoking stuff I want us to do on Friday, and then we'll test probably the week after that. So we're not too far behind. We should be okay. But today we're going to talk about respiratory disorders. And this is the one you hear about on the news, or on not the news necessarily, but on the commercials all the time, talking about COPD. And this is chronic obstruction pulmonary disease is the first one we're going to talk about. And it's to be exemplified by chronic bronchitis, which these are the two main categories of these. They both fit into COPD. And these are major causes of death and disability in the United States. And I hate to tag it, but especially right now. It's the people with these two things. We talked about this being the perfect unit to study COVID-19 and all this other kind of stuff. These are ailments that a lot of these people already have. And so when you start attacking the goblet cells and the ciliated cells, and your body can't get rid of these things, the COVID-19 virus comes in and attacks itself, and is basically your body doesn't have the defense mechanism to get rid of it. And it just sits there and replicates and replicates and replicates and destroys your cell. So I don't know if you guys have heard about this, but there's this thing about holding your breath for 10 seconds and making sure you can do it every morning when you first wake up. And what they're doing is they're testing for what's called fibrosis, and to see if you have any of these damaging things already when you shouldn't have chronic bronchitis and emphysema at your guys' age. But these are the things they're having people who think they've been exposed, or just people in general thinking they might have that in there. So this is what we're going to talk about today. All right. And so features of these diseases, because again, both emphysema and chronic bronchitis fit into this, is usually patients almost always have a history of smoking. All right, and so that's why we're going to spend a day. I'm going to send you lots of smoking videos, anti-smoking videos, and things like that. But massive labored breathing, which is called dyspnea. All right, dyspnea is just you just can't breathe very well. And again, these are the issues we're talking about here with COVID-19. This labored breathing, just taking more effort than it should just to breathe in and out all the time, becomes progressively more severe. Coughing, frequent pulmonary infections, and things like that are very, very common with all of these things. Your body's trying to get rid of the stuff because it knows it's, the lungs are trying to expel all these kind of things. It's just not happening, just not there. And that makes your labor breathing even more and more because you can't get rid of it. Okay. Most victims retain carbon dioxide because you can't get that stuff out of your lungs. It's hypoxic and has respiratory acidosis and causes things to go in there. If you ever heard of asbestos, asbestos is another thing. It's called asbestosis. It comes in and basically does the same thing. It gets in there, it mixes in with the fibers, replaces the alveolar stuff. The stuff retains that carbon dioxide, and it just can't work for those kind of things. So eventually, those infected will develop respiratory failure. You just can't breathe. You can't possibly get enough oxygen to do all the things that you need to do. So, it's just one of those things you have to worry about with these things. So emphysema itself, my mother-in-law has this due to her smoking habits and things like that. The alveoli are enlarged as adjacent chambers break through. So basically it's like popping balloons in there, and those were these little nuggets or little things at the end are doing the gas transport system for that. Chronic inflammation, again, promotes lung fibrosis. Airways collapse during expiration, like literally just goes away. There's nothing that can hold on to it. And patients use a large amount of energy just to get the air out. You'd think that, it's the breathing in that's the problem. It's actually getting the air out. All right. And so a lot of people who have emphysema, they have overinflation of the lungs, leads to permanent expanded barrel chests. And cyanosis appears late in the disease, and you can't get rid of the carbon dioxide, and everything goes away. All right. Chronic bronchitis, however, is mucosa of the lower respiratory passage becomes severely inflamed. And so if you've had a lot of damage over the years, and this is where my doctors are fears sort of I'm getting to at this point in my life, it becomes severely inflamed, mucus production increases, you have the pool of mucus, impairs ventilation and gas exchange. Basically what it's saying is that they're so inflamed that they're triggered to do all these extra things that they normally should not do. Your risk of lung infection increases greatly. You get chances to get pneumonia is very common with this. You get, the sinus infection that most of you guys get, where it just drains out and you heal in a week or so. for bronchitis patients is going to be 2 weeks at the minimum, at least, because it's going to be a week for your body to get rid of it, and then another week for your bronchial tubes to relax, where you stop coughing and doing all this sort of kind of stuff. So again, it's the same premise. You have trouble getting air in and getting the carbon dioxide out, and the all that kind of stuff works out. So this is where, for me, it's triggered as exercise induced asthma, but basically it's when that air gets in there and triggers it. I take a respirator to help open, or I take an inhaler, sorry, to help open that stuff up. But people like in the COVID-19 had to be on permanent respirators, try to get the air in and out of their lungs as much as they possibly can. Okay, so here's the idea of what causes these things. In hindsight for things, one is obviously tobacco smoke, air pollution, other kind of allergens can kind of cause that. Continual bronchial irritation and inflammation, break down the elastin and connective tissue in there, and that helps to destroy the alveolar walls, leads to lung fibrosis and air trapping, so it can't get the stuff out. For chronic bronchitis, this thing is so inflamed, it just keeps producing excess mucus. Chronic productive cough, like you're always coughing stuff up. Some of you guys probably have your dads or grandpas who, disgustingly, however, but they cough up stuff all the time. But no matter what happens, it's you get labored breathing, the airway obstructions or air trapping getting in there, and a lot of infections happen there because now you lose that ciliated ability to kick that stuff out, and eventually your lungs will fail and all of that kind of stuff as well. So it's just part of the symptoms of those kind of things. Now we talked a little bit about cancer, and we talked about skin cancer or whatever, but now we dig a little deeper with this. And if we were together, we would do a lot more cancer stuff than we are here. But lung cancer accounts for a third of all the cancer deaths in the United States. Obviously, increased incidence associated with smoking. One of my buddies was a baseball umpire, and he smoked every day of his life forever, and his wife died of secondhand smoke cancer and lung cancer, and she never smoked a cigarette in her life. And then he eventually died of lung cancer as well. So it's not just the smoker, it's the one you're with as well. 3 common types: squamous cell, adenosarcoma, and then small cell sarcoma are 3 types of things that can happen. Now, other kinds of respiratory ailments that happen. Okay, one is called SID, sudden infant death syndrome. And apparently a healthy infant stops breathing and dies during their sleep. Okay. Some of them, looking deeper into them, a lot of parents, blame themselves for SIDS and things like that. But a third of the cases appear to be heart rhythm abnormalities. It's really more of a heart ailment than it is respiratory or whatever. Some of it's have to be a problem of the Respiratory Control Center. So that's why, when you're a parent, you watch your kids sleep all the time. You want to make sure they're breathing in and out and doing all the stuff that they're supposed to do. But SIDS is exactly like it sounds: sudden infant death syndrome. It happens, right away. Just they stop breathing for whatever happens before. And so a lot of people research think that it's going to be the Respiratory Control Center. So something's wrong with the signals sending through there, and they just stop breathing for whatever. It's not necessarily that they're on their belly and they suffocated. That's a whole different issue. It's literally SIDS is when your brain doesn't tell your lungs to breathe, and you lose that involuntary control. When you're a baby, you don't think about that, and even as adults, we don't think about trying to breathe in and out all the time. It's just one of those things that happens. But again, a lot of times it's due to heart more than it is to anything else. But if it is for the respiratory control, it's based on the nerves and the neural factors that go into there. Asthma, again, chronic inflamed hypersensitive bronchial passages, again, can lead to chronic bronchitis, like we talked about. It simply is response to irritants. So allergens, pollution, smoking, just dirty areas, like when you drive through like a place and there's a lot of dust and things like that. Irritants get in there, and then you just can't breathe. It's just this constantly inflamed passageways of where this stuff is going to, go through. And, like for me in running and things like that, it's, cold air does it to me. So like running, I'm recording this on the Friday before spring break, and, I ran a lot this morning in this cold, moist air, and it just, came home and coughed like a half hour till my bronchial passage just relaxed and calmed down, and I could hit them with an inhaler. Response to irritants, coughing, wheezing, just having trouble getting out of the air. It's not that you can't breathe, because I can breathe okay. It's just my bronchial tubes were just like, hey, get this stuff out of here, like there was something in there, even though there really wasn't. So asthma is simply just hypersensitive bronchial passages. gets to the point where it could lead to chronic bronchitis, where they're always inflamed and they're always coughing of that nature and things like that. Not just like me, whatever, but people with severe asthma, have trouble breathing all the time. So you have to take your inhalers. Your inhalers need a 20-minute time period. I used to, love and laugh at football players who said, "I need my inhaler to like finish the last 5 sprints," when the inhaler wouldn't kick in for 20 minutes after that. The medicine in the inhaler, albuterol usually, needs time to go in there and actually relax the bronchial tubes and calm them down. You're basically putting, an anesthetic on your bronchial tubes is what the inhaler is doing. But it needs like 20 minutes to work and 20 minutes to, get everything set up for what it needs to do. But again, just responds to irritants with the asthma that's going there. Okay. So last little section of every chapter, is all about developmental aspects of the respiratory system. Lungs are filled with fluid in the fetus. Obviously, the babies aren't breathing yet. Lungs are not fully inflated with air until 2 weeks after birth. All right. So when you guys are parents, you're going to hear a lot of gurgling and things like that. And you're going to think something's really wrong with you, but there's a little bit of liquid still in there that they have to get out. There was a movie called The Abyss where they wanted people to go massively deep in the oceans, and they had them, it's totally fictitious, but they had them put them inside of a water chamber so their lungs could breathe from the water again, like they were fish or whatever. But the sentiment was there because you used to do it when you're a baby, and that's what they said. This is your body will adjust back to the way it is, but obviously that's not going to do that, but that's the way it goes. So, the surfactant that lowers the alveolar surface tension is not present until late in fetal development, and they may not be present at all in premature babies. And so that's why you see a lot of premature babies on respirators and things like that. Again, hit to bring up COVID-19 for this whole thing, but that surfactant that's been taken out, that mucus layer of the goblet droppings, is the same premise we're having here. It's like you're an undeveloped child when you've had those things taken away and you just don't have the thing that you need to have. Okay. Other kind of birth defects, we talked about a couple of these: cystic fibrosis, oversecretion of the thick mucus clogging the respiratory system. So here's where your mucus compensates for things. Cleft palate is where the palates aren't grown together as much as they should, and so it leads to speech defects, but also going to lead to breathing problems too, because you have a constant opening all the time. Everything's got to be taken care of that way. Okay. Aging effect: as you get older, the elasticity of the lungs tends to decrease. Your vital capacity, about the amount of air you can take in, will decrease because of this elasticity. Blood oxygen levels decrease, so you need more of the oxygen to take in. And stimulating effects, carbon dioxide, decrease. So your control, your neural control, which is usually done by the carbon dioxide, isn't kicked into gear as much as it should. So that's why as you get older, which we always say getting old sucks, all right, you have to take these stuff into account. And because the more damage you do to your respiratory tracts, the more risk you are for infection. All right. I don't know how many of you have ever had pneumonia or whatever, but once you get pneumonia once, you are susceptible to pneumonia a lot. And so it's, you start damaging that thing. Now it's like, it's almost like you're giving it a place to come in and, damaging these kind of things, which again, going back to COVID-19, all right, you have these people with these ailments already, this, either emphysema or chronic bronchitis or something of that nature, and it's already in there. And so now that virus is a very easy pathway to get in without anything else to, stop it and make it go that way. Okay. So as you grow, respiratory rate your changes. Obviously, newborns breathe a lot, 40 to 80 respirations per minute. Okay. Infants breathe 30 respirations per minute. Ages 5 to around 25 respirations starts to settle down. And adults, obviously, depending on your activity, all right, 12 to 18 respirations per minute. Rate often increases somewhat with old age because, like we said, you lose this blood oxygen concentration, you lose the elasticity, you can't take in as much air as you need to. And so a lot of times I'll have, patients come in with, like my dad with heart surgery, they had to train his, expand those lungs and get more air in because it's just easier for them not to do it. And, they have to stretch it out. It's like a balloon just loses its elasticity and they have to stretch it out and continues on. Okay. So I think that's it for this, and do the questions that I signed for today, and we'll do a little cancer activity with the next one and some smoking stuff, and we'll then review and go from there. Okay. Have a great day, everybody. Be good.